A pleasant day and a warm welcome to a medical discussion I made. So we were discussing about many topics, and last week we were concentrating on skin, and this time also we are going to concentrate on the skin. So skin, the appearance matters. You love to maintain a good appearance. That's not because of your own well-being, but you need to present yourself to the others, to the society, to the community in a pleasant manner. You don't like to cover the skin with some sort of plasters or even any other clothing. You have to be nice in your attire, but like what concentrate those things is a proper skin hygiene. And today we are going to discuss about the skin hygiene, what concentrate those things and what constitutes those aspects, and even we are going to discuss one of the most important things, lumps and bumps, tumors on the skin. So to the honors, we invited Dr. Janaka Akaravita, consultant dermatologist of the National Hospital of Sri Lanka. Thank you very much, sir, for accepting our invitation.
It's a pleasure.
Right. So when concentrating about these conditions, sir, to the latter part of the program, we can discuss about the skin hygiene. So what can we do to our skin to maintain a good health and a good well-being with regard to the side of the skin? And first we'll just concentrate about the lumps and bumps of the skin, the tumors. So can you just expose the topic?
Yes, actually tumors, the lumps and bumps. Tumors are overgrowth of tissue. So this now we have the normal growth and the normal structure. So when due to various reasons, some tissues, some types of cells start overgrowing. So that will end up as a tumor or a lump or a bump. So these lesions can be benign, that is they are not cancerous. The others are malignant, that means they are cancers which will spread and sometimes can be lethal. So that is the cancerous type. Luckily we have a lot of tumors on the skin, I mean, but luckily cancerous tumors are rare among
Right. Okay. So when a tumor appears, sometimes people tend to see the tumors appear and they disappear. Sometimes they tend to sustain a considerable period of time, then disappear. Sometimes they might feel like the tumor is there for a longer period of time, 10-15 years, no harm, right? Tumor is also happy, I'm also happy, they are waiting in a manner that okay, nothing can be done. So when a tumor appears, it's usual and it's the good practice that we need to consult a doctor. But when it comes to home remedies for the people to understand, so can you just expose like these types of conditions appear in these cases likewise with your experience?
Yes. Now actually when we talk about the lumps and bumps, there are so many lumps and bumps. Some of them are from birth. So we have some by birth there are these bumps, but usually the moles, which we call sometimes birthmarks, appear later. So they appear in the teenage. So sometimes that's a misnomer actually. There are moles where the melanocytes are much more than compared to the normal skin. So they will usually appear in the teenage and progress till about mid-20s, and then they become static and sometimes regress even in the latter part of the life. Then there are bumps which appear in the middle age, sometimes latter part of the life, which are very common, like a dark color, tiny papules which occur over the face, sometimes neck, the other areas of the body. So there are so many actually, there are different types of bumps which are so much not cancerous. So they are, I mean, so common. Sometimes somebody who is in 50s, 60s, you will see one or two types of bumps which the patient is not concerned. Even medical wise we are not much worried. But there are certain types of tumors which appear sometimes maybe just like another bump, but later on become gradually enlarge and then cause symptoms like pain, itching, bleeding, then gradually spread and ulcerate. So then those are we have to definitely think about skin cancers.
Right. Okay. So when you talk about that tumor conditions, lumps and bumps, when a certain condition appears, so normally we just do, before meeting a doctor, we just do some local examinations. We are going to press it and we are going to squeeze it. We see whether the pain is there. We see whether how the appearance is there, whether it is the site is being reddened, or if it is hot, the temperature is elevated. We just people tend to do some examinations on their own, and they tend to decide, all right, okay, now it's the time to go to a doctor. So when those types of conditions occur, what is the best advice as a consultant that you can give? So this is the time when you should meet a doctor. These types of conditions, you must not wait no longer. Likewise, what can we give?
Yeah. Now that depends on the type of tumor actually. Now if we are concerned about the skin cancers, number one, I want to emphasize, skin cancers are very rare among us. Among us means the pigmented skin.
Right.
So that is the advantage which we have with our colored skin. So the fair people have less melanin protection. So we have melanin covering our cells in the skin. So the melanin does not allow ultraviolet light to go to the nucleus and make the changes which will cause them to proliferate without any control. So that's the advantage. I am emphasizing this because people think the colored skin is a disadvantage.
And they tend to do applications and make it more fairer.
Yeah. But we have been given a gift, so to live in the tropical countries, the climate with sunny climates. So we have protection from melanin. So but if you have a bump which gradually over a couple of weeks, months, gradually enlarge and sends messages that it is there, it itches, sometimes pain, sometimes when you sort of do something, there little bit of bleeding. And when there is a sudden color change, the color, brownish color, then becomes dark black color. So likewise, so if there is any change and if some part of the bump behaving differently, so it is trying to protrude out, so those are definite indications that we have to do something. Most probably go for a excision or biopsy or things like that. But commonly the lumps and bumps is a cosmetic problem.
Right. Okay. So you got some information about certain conditions, and there's a blessing in disguise where you have a fair, darker skin. There's a melanin protection for those types of cancerous agents. So don't try to make it more fairer by using bleaching agents, and like white skin will let you in trouble in future. So that means not all white people, they are more prone to these diseases, and you will definitely get a cancer. This is a tip that we can share with, and doctor shared with you all. So ladies and gentlemen, these are the disciplines that we can deal with when considering these types of infections, or rather the tumors, that the complexities that they occur with. And so like when it comes to a certain tumor condition, doctors advise, right, okay, so you must have a surgery and remove this. So sometimes, okay, don't need to have a surgery, this will prevail to a certain time, and medically it is not concerned, as you said before. But I wanted to emphasize is that there is a common general belief in the society that they believe when a surgery is performed, there will be certain consequences. Sometimes for a cancer thing we should definitely perform, otherwise our life will be in trouble. But in certain conditions, all right, this can be done through a surgery, but like if the doctor says that it's okay, normal, but people try to remove from the surgery. So doing a surgical mechanism, undergoing a surgical procedure to remove these lumps and bumps, will it cause certain consequences in the later part of our lives?
Actually, no, these skin bumps are sort of, they are usually, if you don't wait till they become very large, can be easily removed.
Right.
So we have the access. It is the external organ. So we have the access. So we can do it under local anesthesia, and it is easy to perform. But as common to any medical procedure, there are certain issues, side effects. So sometimes it may be a little bit painful during the induction of the local anesthesia, and sometimes there may be a little bit of pain during first or second week. And the other thing is the infection, very little possibility that there can be secondary infection. So those things can be prevented with cleaning the wound and having a good dressing. And the other thing which we can't prevent is the scar.
Right.
So there will be a scar. So then that will be, I mean, whatever you do, there may be some amount of scar. So that also can be minimized if you plan it and do it. Other one thing I want to mention, Charity, is there are so many skin bumps and lumps. So always we don't need to go for surgical excisions. Sometimes there are benign ones. Those are the common ones. So we sort of like cauterize, that is as if we are burning them. So if they are very small, like say skin tags, and there are tiny blackish tiny bumps on the face, neck area, common ones. So those things we can do with cauterization machine with a bit of cream to numb that area and cauterize, and that will be gone by 2 or 3 weeks time. And we have a method freezing the tissue.
Right.
So we use the nitrogen gas in liquid form, so that is very cold. So we spray it to the these benign bumps, so they freeze and the cells get damaged, and then after 1 week the bump is going to fall off, and the wound usually heals with the minimal scar, sometimes no scar.
Right. That means there are certain advanced mechanisms that we can adopt if we are continuously engaged in certain sort of a study and proper advice.
Yes.
Right. Okay. So that is clear for you all. When it comes to a certain tumor or any other disease condition, it's common that if you take the medical advice in the proper time, you will not fall in trouble. When it comes to the skin conditions, people concern a lot is that the presence of scar. That means it will deteriorate your appearance, or it will remove out of the prestige or the appearance that you are maintaining. So this is a disease condition, or if it is to be removed under medical advice, no use of keeping that thing for the sake of the appearance. So there are certain conditions. So the best thing is that to take the best advice and to adopt the specific, very clear the technology that we use, that they implement in order to give a minimum effect. So there are disease conditions, there are treatments. So the most important thing is that the possibility of identifying and possibility of obtaining the particular advice on the proper time. And so like when it comes to just exposed to the cancerous agents or the cancerous tumors present, what are the conditions they are on, like the wound is being progressed, and what are the treatments that we do have?
Actually, when skin cancer, so there are the common form of the skin cancer is something called BCC that we can surgically remove, and so the luckily it doesn't spread commonly, it is only the local spread.
Right.
So other than surgical removal, again we can use this type of tissue freezing. Sometimes we sort of curettage and remove it. Sort of the type of treatments are there. So when it comes to the other types of skin cancers, which are a little bit more rarer, so the surgical procedures are much more important in handling them.
Right.
And especially the melanoma. I mean, melanoma is very, very rare, but if it occurs, then definitely we have to remove the tumor and look for the spread of to the other. Sometimes that's for the glands, sometimes to the other organs.
Right.
So that is if you wait for a longer period without being attended.
Right. Okay. So you mentioned about several types, the basal cell carcinoma, melanoma, that there are many further types that you can concentrate on when it comes to the cancer. And we are going to expose about in detail about those subtypes and move in detail. But what you emphasize is that there are certain treatments. And so one more question on cancer. People might think that like the cancer is there, the skin cancer is there, right? There are certain mechanisms. Can we stop the spread of cancer to other organs by implementing the proper strategy on proper time?
Yes. Yes. We can, I mean, if you present early, then that is the good thing what the patients can do.
Right.
And then so they spread only in the later stages.
In a certain case, medically, can we term them as cured patients?
Yes.
Right,
yes.
not only the symptoms, but the root cause, whatever it is remaining, we can remove them. Right, so clear. If you identify the proper disease condition, proper ailment, the condition on the proper time, you have treatments. Right, now that is the skin. So we dealt about certain conditions, the scar formations of certain consequences, the tumors, malignant, how the treatment's going on, how to implement the proper treatment on proper time. And now let's concern about the skin hygiene. So as a consultant, sir, you might have met certain patients, they tend to fall in trouble to the lack of maintaining a good hygiene, a good practice with regard to the skin. So what are the advices that you can give with regard to this?
Actually, now maintaining skin hygiene is important to maintain our appearance. But other thing is sometimes people think that maintaining skin hygiene is to become fairer. So that concept should be, I think, discouraged. So so there are so many world figures who are not fair. So but in our culture, the people have a madness for being fairer. So that with that sometimes people fall into trouble. So they use various things to become fairer. So if you want to really be fairer, take a proper medical advice. I don't mean that we recommend to become fairer, but don't use unlicensed or home remedies or something which doesn't have any label, anything which doesn't indicate what it contains.
Right.
So that's one aspect. The other thing is now, like any organ, any system, there are certain things which we can do to maintain our normal hygiene. So there are several aspects. Now we should not avoid doing certain bad things to our skin. Some people rub with various things, so that's a very common thing, and so they use loofah and we mix stones and various things. We have seen so many patients who come with dark skin colored areas, dark patches, due to this frequent rubbing. That can lead to sort of various disease conditions which causes the skin darkness and roughness. So then various myths about bathing and those things. So actually we in a tropical climate, better to have a daily bath. But anyway, we have to use a proper sort of soap. There are some people who have dry skin. So in that situation, better to use a suitable type of cleanser rather than using the common soaps, and then proper use of moisturizers, and attending the even minor changes, attending it properly, and generally sort of avoiding too much of sun exposure also is an advisable thing in a country like ours. But don't worry just to go for 10 minutes or 30 minutes out in the sun. But if you are exposed to for a longer period, then better to cover yourself or use a sunscreen.
Right. Okay, so you gave numerous advices, and just for clarification, I will quote a small position there. Earlier you mentioned don't use common clothing with regard to certain conditions, like using common towels and everything will spread certain types of infections. And you mentioned now not using a common soap. Common soap as in can you just clarify that?
No, that is common soap means the commercially available normal.
Right. Okay, I think it's very much clear.
Yeah, that is now actually our skin, the pH is around 4.5 to 5.5. So when you apply the soaps, they are alkaline. So the acid level will shift to the basic side and alkaline side, and so that will sort of alter our function of the skin.
Right.
But in a normal person, it's quite okay, because in about 30 to 60 minutes, the acid level will be back to normal. So you can use normal soaps. I mean, normal means the commercially available usual products. But if you have a disease condition, dry skin, then better to either use soap-free cleansers or use a special type of soap which will support your skin to maintain the pH balance.
Right. Okay. So now it's clear that common soap, as in doctor explained you what that common soap is, right? No need to fuss about that. So you need to have clear explanations, and so we are going to conduct these programs for the sake of your benefit, to enlighten you in order to get to know about certain disease conditions, and most importantly the preventive adopting strategies that you can implement to your daily life. And so, like, one more condition that I want to emphasize here with regard to this skin hygiene, people they try to use some applications which are not even, like as you mentioned, people just try to search their own home remedies. So now the social media and certain platforms, they provide certain applications, right? You can prepare these paste at home. So sometimes certain acids are also used, sir, and in that condition people, when they apply, there might be certain severe conditions. Can you just explain the consequences of applying those non-licensed or not suitable products?
There are so many. Actually, sometimes they can cause your skin to get infections, the folliculitis. Sometimes they may make your skin lighter, but when you go on applying, then you will realize that your skin has become so thin, so that the blood vessels are going to be visible. So then you become a bit of a, I mean, the appearance is not so good as you expected. So then you develop stretch marks. That is, these preparations make the skin thinner, that skin cannot withstand the stretching effect. So it's dry. Then sometimes you end up with certain infections, and sometimes younger, middle-aged people end up with a lot of acne due to these applications. And sometimes these applications may contain mercury. So then later on you may have systemic effect of chronic mercury usage. So there are so many that type of consequences. Right, local applications.
And some people tend to have some internal medications as well. So are there any internal medications, like sometimes there might be even the external applications, they are a licensed product, and that means under proper research and certain testing mechanisms, they have introduced to the market, that's why people are using them. And so are there any internal medications that people use to become certain to have a good skin complexion?
There are preparations, but they are used for certain other indications,
right?
Not to become fairer. So now, like say, if you have a cancer, then you take some treatment, but you end up with a complication. But that is always we think about the benefit. Risk and benefit. So if the benefit is better, we take a risk. But these products we don't recommend the systemic. There are injections, sometimes oral. We don't recommend those injections and the systemic treatment to become fairer.
Right. Okay. So that's clear. Even there might be external applications and internal applications are there, but depending on a certain condition where the doctors specify, there are conditions that you must use. But it's not like being fairer, or just it's simply if you can be fairer by using a small pill or something like that. Any person can do anything in this world, right? So you must concentrate on those things, and specifically when you concern about the health, you have to concern a lot. Why? Because you can just apply a certain medication and develop a certain uncurable disease. So who are going to cure the disease, and who will be assisting you to maintain your appearance? That's only you. So, and one more thing, can those things end up in a cancer? Certain applications, harmful things to be done to the skin?
Yes, that is in long run. So the skin cancer risk can be increased. Not that they are definitely end up with, but the risk can increase.
Right. Okay. So now you're being scared. Like if you are using an unauthorized or any preparations that is not been specifically tested, you have a possibility in the long run to be end up in certain harmful conditions which is incurable sometimes, such as a cancer. And so like we discuss about tumors and the consequences of having those things and the proper treatment strategies that we are going to follow, and even give good guidelines and specifications and advices to maintain a good healthy skin. So thank you very much, sir, Dr. Janaka Akaravita, consultant dermatologist of the National Hospital of Sri Lanka. And thank you very much once again for accepting our invitation and doing the honors with these skin related conditions. And so with iMed, we have discussed numerous topics, and in the future also we are going to discuss many more disciplines that will benefit you all to maintain a good well-being, which is physically, mentally and socially, and sometimes with discomfort you'll be spiritually well-being also with these good advices. Thank you very much for your watching. Stay tuned with iMed. Have a pleasant